Interesting enough, the primary seller of crack cocaine at the street level is a black male, but the average buyer at the street level is a white person, very high income. So I think there's a lot of images about drug abuse in our society that we simply don't understand, but it's reinforced again by media and so forth.
Well, now what can we do in order to try to counteract those as images within ourselves?
Well, I think that we have to start, seeing how those images are, start shaping young black people very, very young. I mean, if I go through Nashville and ride through black communities, I would probably see more liquor advertisements, more cigarette advertisement than I would in certain white communities in this city. In fact, Reverend Calvin Butts in New York has taken to, you could say an extreme measure of actually whitewashing those billboards that are in the black community. I think at very, very young ages, we see the reinforcement of taking drugs in our society, particularly among black males. You probably remember about a year ago, Joe Camel, that guy, which I think is a black male image, by the way. I'm looking at that as a psychologist, of course. But
I want you to explain that as Joe Camel as a black
well,
male.
Joe Camel is now recognized by young children, not just black children, but white children as well, as being more popular than Mickey Mouse. He has higher recognition. So here we have an image of a cartoon character, a camel, at a very young age being reinforced in the minds of children that smoking cigarettes is okay. I think those images are particularly hard hit in poor neighborhoods throughout our country. And cigarette smoking, as we just saw in the recent Surgeon General's report, is decreasing among all age groups except women and among blacks and Hispanics.
And so that helps to reinforce the consumption or the smoking of cigarettes among many young blacks. But do we have any kind of statistical information with the impact that it is having upon this group itself, upon young blacks?
Well, lung cancer among, heart disease still remains the #1 problem among black Americans. Lung cancer is increasing, and I think directly as a result of, how cigarettes are put in our community. If you look at the sports events and the many of the musical concerts that occur in the black community, many of them are co-sponsored by tobacco companies. The same thing with liquor companies. It's almost as if the liquor and tobacco industry have kind of given up in trying to target that, upper crust, white, male, suburbanite, male or female, and say, well, let's go to poor people. And I think it's alarming, the statistics that we see among, tobacco use and liquor use among those groups. There's certain alcoholic beverages in the black community that are almost totally consumed by blacks. For example, malt liquor. I've read in recent statistics something like 80% of that liquor is consumed, which is really just fortified beer, consumed primarily by blacks.
And that's a much stronger beverage than ordinary.
Absolutely, absolutely. Just like high-priced liquors. I don't want to name any on your show, of course, but all of us know what we're talking about. And those high-priced liquors have a high rate of consumption among African Americans as well.
As a psychologist, why would you say that? I mean, why would, it seems to me that the poorest segment of society would opt out for the most expensive drink in society.
Well, there's a term in sociology called conspicuous consumption, coined by Thorstein Veblen. It says that people who don't have sometimes like to take things that, they feel that the rich have. And I think that, to sip a certain type of cognac or whiskey or whatever is kind of, resembling, what is perceived as being upper class, well-to-do or whatever. And I don't think that any, poor people are, very, very no different from that. It's a stereotype, but I think it's, again, I've talked to many people who say, well, these groups kind of can, do what they want to do, freedom of choice and so forth. I think you should have freedom of choice, but I think in light of no choices, there is no freedom of choice. Absolutely.
Very good. One thing that we've had a problem with in this state, Doctor, has to do with the system of correction. And I think one of the real issues dealing with the black male has to do with his imprisonment. And if you look at the state of Tennessee, a very large percentage of those incarcerated are young black males. And let's talk about that. I mean, how would you compare what we're attempting to do in the state of Tennessee with Well, let's talk about it. You talk about it.
Well, you know, as a student of black culture, I look at black male incarceration as an historical as well as a contemporary problem. Black males have always been incarcerated at high rates in this country for petty offenses as well as important, you could say more serious offenses. That black males are incarcerated right now at probably the highest rates in American history, I think is no mere coincidence. Black males are perceived as being very, very dangerous. I think it's interesting in the trial, the second Rodney King trial that's going on in Los Angeles right now, that one of the officers referred to Rodney King as being like a mandingo, whatever gesture he made towards his white female police officer. I think that black males being incarcerated right now is just a reflection of how the society in general views black males as being very, very dangerous people. And images on television reinforce that as well. But even before this, if you go back to the history of this culture, Woodrow Wilson said the greatest movie at his time that was ever made was Birth of a Nation, which reinforced the image that black males were somehow going to rape white Southern womanhood. And I think that image is still there. It was